Vaidyo Narayano Harihi. Dr. Prem Agrawal, President of the National Medical Forum and Chairman and Co-founder of the Medical Dialogues. Dr. Naresh Goyal, Advisor. Dr. Ashok Bagga, Director. Ms. Meghna Singhania, Chief Editor of the journal Medical Dialogues. Proud winners of the BlackBuck Awards in all categories. The BlackBuck, as a veterinary surgeon, I know stands for resilience. I hope all the awardees will be as resilient as the BlackBuck. Members of the media, a very good morning. The Charaka Samhita, authored some 2000 years ago, says, Sharire Jarjara Bhute Vyadhigraste Kalebare Jannavi Toyam Vaidyo Narayano Harihi. The doctor is said to be the embodiment of God himself. The exact dates of origin of the Charaka Samhita remain unclear, but it is acknowledged by scholars worldwide that it flourished for a 400 period between 2nd century BCE and 2nd century CE, the Common Era. The Encyclopedia Britannica, updated by Cara Rogers of the United Kingdom recently and revised, refers to the Charaka Samhita as a comprehensive text on ancient Indian medicine and to Charaka himself as a practitioner of traditional system of Indian medicine. The scholar Cara Rogers also suggests that the Charaka Samhita may have been refined and rewritten by Charaka from texts written several centuries earlier by Agnivesha, one of 6 disciples of Punarvasu Atreya. I found it also to be of interest because my birth star is Punarvasu. So we are referring to texts nearly 2500 years before today. I do not have any doubts on the credentials of Encyclopedia Britannica, a set of which I received from my father-in-law some 35 years ago. And I'll come back to this important subject on the crying need in this country for good research and for preservation and sharing of records in a minute or two. If there is one person in this august audience with a capacity to correct my reference to the shloka from Charaka Samhita, it has to be my childhood friend, Dr. Srinivas Ramaka, a cardiologist of eminence in Telangana. Srini, can you please rise? The shloka is Sharire Jarjara Bhute Vyadhigraste Kalebare Jannavi Toyam Vaidyo Narayano Harihi. Srini and I studied Sanskrit together at the AP Residential Junior College in Nagarjun Sagar some 44 years ago in 1980. He was a topper in our batch in Sanskrit. Can we have a round of applause for that scholarship? It is primarily at his urging and the persuasive skills of both Dr. Prem Agrawal ji and Meghna Singhania ji that I am in your presence today. I told Srini, spare me my Sunday. I have approval from Government of India to incur a significant amount of expenditure for digitizing my records. He suggested that this was precisely why I should be airing my views today, and he actually helped me. He suggested that maintenance of records and then digitizing them over a period of time will be of key and crucial significance. I cannot agree more with him on this. I think I've done 5 minutes, but and Meghna ji is looking around nervously. I'll just have 4 or 5 points to make before I go back to my chair. First, COVID-19. There is a nationwide appreciation among ordinary people in India for the dedication with which doctors, paramedical support staff, many small hospitals, And importantly, the administrators and law enforcement agencies stood up together in the largest populated country on planet Earth. Effectively and collectively, we did not see tens of thousands of body bags reaching Azadpur Mandi in July 2020. It is very easy to forget that this was just 4 years ago. My suggestion is for this medical research summit and the medical dialogues to look at Srinivas Ramaka's work on the registry on out-of-hospital cardiac arrests that he did for Warangal. It will be useful if a similar registry can be attempted with reference to COVID-19, but with a difference. Ideally on lessons learned from handling of COVID-19. Can Medical Dialogues 2024 in Delhi look at existing capacities that are in India if a more serious pandemic strikes us, God forbid, in 2025 or 2026? We in the Ministry of External Affairs, under the able and dynamic leadership of my Minister, Dr. Subramaniam Jayashankar, ensured that vaccines were available in adequate quantities, not just for needs of our population, but also for people of 140 other countries. There is no other country on planet Earth, I repeat, there is no other country on planet Earth that has been able to do this, not even the country that presented the virus to the world. Second, my friend Srini may perhaps be the first medical professional and scholar from the private sector to be supervising work of a PhD student in Telangana. I am confident that our colleague of the same name, Srinivas from National Medical Council, who I am told will be in the afternoon session, will take note of this and make needed adjustments to its policies and regulations with a sense of urgency. Unless we in government adapt, we will perish. Third, our Honorable Prime Minister Narendra Modi ji's mantra has been Sabke Saath, Sabka Vikas. This philosophy has been running in tandem with Honorable Pradhan Mantri ji repeating ad nauseum our innate and very sincere belief in Vasudhaiva Kutumbakam. The whole world is a family. And Sarve Jana Sukhino Bhavantu. Let all people be happy. All our embassies and high commissions abroad covering the 200 odd countries in the world have and continue to reach out to our friends abroad with our Shanti mantras for global peace. As High Commissioner in Uganda in 2014, I was a small instrument in ensuring that the Foreign Minister of Uganda, Sam Kutesa, as President of the UN General Assembly, enabled a declaration of 21 June as the International Day of Yoga. Some 177 countries supported us unconditionally. I think we must take great pride from this. Medical researchers in India must look at how much of this has happened within India in the past 10 years alone, and whether our Ayush ministry has been able to deliver. When you are looking at Ayurveda, when you are looking at Unani medicine, when you are looking at Siddha medicine, when you are looking at homeopathy, I think we need a coordinated approach at a very minimum. Fourth, the Medical Research Summit, Dr. Agarwal ji must try and look at the present admin setup for medical care in the United States of America. When someone dials 911, the person at the other end has the medical record of the patient in a flash. When someone dials 911, the medical superintendent who is receiving the call, within a flash of a second, has the medical record appearing before his or her computer screen. What can we here in India do to have real-time data available with ease of retrieval from e-records when they are needed? Will establishment of an institute such as the National Institute of Health, for example, in India, help us better in addressing ill health and in pacing towards a Vikasit Bharat by 2047, marking 100 years of independence in this phase of Bharat's existence as an independent nation state? Fifth, this Medical Research Summit should attempt recommending budgetary support to all medical colleges for research, which is very sadly only for completing a thesis or to get a promotion. There is no accompanying passion for research. Every medical college in the country should obligatorily have a research board. It is not a utopian thought. Sixth, every doctor receiving a BlackBuck award today, including my friend from college days who's receiving a Stellar Researcher Award. Congratulations, Srini. Irrespective of the category, whether it's a pioneer or stellar researcher or rising researcher award under the age of 45 years, must necessarily work to see why even 10% of those in the 110,000 MBBS seats in medical colleges in India today, or the approximately 47,000 odd seats in MD and MS specialties, are not being able to contribute to research. 541 colleges are churning out MDs and MSs. Just the last set of points. Disparities in allocation of funds for research to various institutions. You referred to this earlier on. The ICMR, the Department of Science and Technology, and others must look at concerted ways in which the funding of medical institutions can be regulated. So what can be done to enhance pharmacovigilance? Today that's an area of concern. I know I'm taking more time than necessary, but I'll quickly run through the remaining 1 or 2 points. How can greater grit, determination and efficiency be suffused into medical colleges in India for focused research on ways and means of improving medical care in India? Is there a possibility of leveraging available machine learning models and artificial intelligence to add to clinical data to predict and forewarn when it comes to communicable diseases? Again, my reference point is Srini Ramaka, who's developed a machine learning model utilizing artificial intelligence to predict sudden death in cases of cardiac arrest. An analysis, I think, of 5 A's are expected in my assessment of a medical professional: creating awareness, being accessible, being affordable, most importantly, being affable, and finally being accountable. I think the practice of medicine is truly an art. The art of practice of medicine includes an awareness in the community when it comes to health, promoting this awareness. Research, again, community-oriented research, and not just that conducted in labs with test tubes and solutions. Treating the T part of the art certainly includes treating, but also I suppose an important component would necessarily have to be teaching and training the next generation of medical professionals. I think this is where we have been lacking, largely because doctors simply do not have time to record for posterity their experiences, how they have handled a particular patient. The doctors in India are very, very uniquely placed. I was in Romania on my last ambassadorial, and I can tell you, a doctor there probably will be very lucky if he treats about 10 patients in a day. Compare that with a doctor in the All India Institute of Medical Sciences. I've had colleagues and batchmates who have come out from All India Institute of Medical Sciences, joining the Foreign Service. If I were to meet an average doctor, he is overburdened from the minute he reaches the hospital. He has no time to spare at all. So, if you are imagining he's treating about 200 or so patients in a day, compare that with the 10 or 12 patients that a doctor or Romanian doctor is treating on a daily basis. and look at the kind of experience that is forthcoming to an Indian doctor, even mid-career Indian doctor. So I think we should draw great solace and great strength from this very fact. I wish to once again congratulate you, Dr. Agrawal ji, having 7 lakh registered members on your portal. I think it's a commendable achievement. And insofar as my personal self-interest goes, I should be able to get information on Charaka Samhita, or for that matter Susruta, from this portal without having to refer to the A to Z series of Encyclopedia Britannica, for God's sake. मैं आपका आभारी हूँ कि आपने ये मौका दिया मुझे यहाँ पे आने का. आई विश दिस वेंचर एवरी सक्सेस. मेरा भाषण जो है एक क्रिटिसिज्म के रूप में मत लीजिएगा. It was just an attempt at a critical look at the possibility of community-oriented research taking root in this great country of ours. Jai Hind.